Hello, my name is Joel Dunning and I'm here at the Cleveland Clinic, and I'm delighted to be with Scott and Alana, and they run the world's best cardiac surgery operating rooms. So maybe if I turn to you, Scott, first, just tell us the volume of cases you do per day, the kind of cases you do, and really what it's like on a daily basis.
Yeah, thank you. So the complexity of cases, I would say, is second to none. We're averaging right now about 24 cardiac pump cases a day, and that encompassing emergencies that are coming from outlying facilities that are flown in and or driven in by ambulance. Multiple pump cases, multiple redos, second, third, fourth time redos. Just very complex cases.
I'm over cardiac specifically. I have over 130 direct reports, nurses and techs that report to me that are specific to cardiac. Surgeons, offhand, we have to have 20 or more just cardiac surgeons.
What would you say might be the elements that make this place work so well?
So multidisciplinary approach, the collegiality of our teams. We are a family first and foremost. From our lead physicians down to every single position, we will work together, we will support each other, because ultimately our supporting each other supports that patient. When you go into the ORs, when the patient rolls in, the teams, the unity of that team and all the different positions they have, the patient can truly feel that he or she is going to have the best care possible.
I'm here with Dial. Dial runs the cardiovascular intensive care unit staff. So maybe tell us a little bit about how big a place is this?
Sure. So the CVICU is comprised of 95 total beds. We're 7 units. Each of us are specialized into our own areas. We have over 500 nurses total, with some support staff in there of clinical technicians, respiratory therapists, unit secretaries. And we're also staffed with our acute care nurse practitioners and our cardiothoracic intensivists.
And things like getting central line infections down and things, you've worked really hard to do that. How do you do that?
So what we do here at the Cleveland Clinic is we tackled CLABSIs with what we call process confirmation. So every single morning, RNs from night shift and day shift meet. They take their process confirmation auditing tool, they go to the bedside, they ensure that all of their lines are secured, their dressings are in place, that all of the preventative maintenance is in place for these patients. And then if the line is ready to come out during our plan of care rounds with our intensivists, the lines will be removed at that point. No line stays in too long.
I'm here with Randy and Colleen, and these guys work on the floor. Once people have been in the ICU, step down to the floor. These are the guys that make them recover super quickly. So just tell us a little bit about the service. What do you do when they come from the ICU? How do you get them up and about?
So, whenever we get a patient, whether it's from a procedural area or from the intensive care unit, the first and most important thing that we do is make sure that they are medically stable. We assess their vital signs, get to develop a rapport with your patient as well. As far as mobility, getting them up, getting them moving around, making sure we're doing all of that safely is one of the most important things that we do up here.
And to go off of what you said exactly about mobility and safety, right? For therapy, for occupational and physical therapy, the first thing we do is we check in with the nurses, see how they're doing during the day. And then we try our very best to get them up, get them moving, and sort of recovering back to their normal day-to-day as quickly as possible.
And just numbers of staff. I mean, the ICU's got 400 nurses. How many have you got on the floor? How many beds, do you know?
On this particular unit, we have about 35 nurses. We have 60 total caregivers for this area here. For the entire HVTI step down, I do believe we have about 700 beds. We have a great capacity to care for a lot of patients.
I'm with Erin and Peaches and Jamil, and they work on the floor here, recovering the patients after cardiac surgery.
My name's Erin Steinhauser. I'm one of the assistant nurse managers here on JD3. I've been here over 8 years now. Some of the things I do to help my patients recover is I make sure I get them up out of bed as soon as we can, because the sooner you move, the sooner you can groove and get out of here. Other things is I strongly encourage hydration. I strongly encourage the use of your sentinel spirometer. All of those things are very pertinent things to help recover, I feel, faster.
Hello, my name is Andrea Robertson. They call me Peaches. I've been here 18 years. I'm the health unit coordinator, and when patients come to the floor, I drop them in the system and I page the team to make sure that they get orders that they need so they can feel comfortable.
My name is Jamil. I'm a RN on J83. I've been within the clinic for 4 years now, but on the floor 2 years. We make sure that all things that the patients need within, whether it's emotional, physical, or mental support, we're there for them, especially after big surgeries. Assessing, daily assessments, constant vitals, ensuring that correct orders are being placed and that they're being followed up by the nurse staff or the aid staff. And then if anything were to change patient's condition, we'd instantly tell the team, letting them know right away. I've taken patients from Asia, the Middle East, Australia, Canada, South America, all over, advocating for patients being able to get up and move around as soon as possible, if it's safe. Once it's safe for a patient to get up, like our, let's say, post-open heart patients. The moment they're on the step-down unit, first thing we do is get them out of bed, get their weights, get their orthostatic vitals. If those are well, we get a walker and they're on and moving. Because they've been in the ICU for a handful of days. They need to get up and move around to ensure they expand their lungs, get back to being their normal self, and start that cardiac rehab.
Thanks a lot for inviting us here. We're going to take a little wander around and look forward to seeing all your amazing patients. Hopefully you're walking up and down the corridor and not sitting in bed. Thank you so much.
Yep. Of course.